Hello, my name is Nicole Sherrard and welcome to the systematic review presentation on the effect of vitamin D3 on pain intensity and quality of life in the presence of fibromyalgia. This systematic review presentation is for APN 760, micronutrients, nutritional and functional application. The objective of this systematic review presentation is to understand the effects of vitamin D3 supplementation on pain intensity and quality of life in females with fibromyalgia. I would like to start by introducing vitamin D, which is a fat-soluble vitamin. It is available as vitamin D2, also known as ergocalciferol, which is produced in plants and fungi, while vitamin D3, also known as cholecalciferol, is synthesized in human skin via the sun's ultraviolet B rays and consumed in animal foods. Both vitamin D2 and D3 are available in supplement form, and this systematic review will solely focus on vitamin D3. 25-OHD serum levels is the main indicator of vitamin D status because of its long half-life, and all of the systematic reviews measured the 25-OHD in nanograms per milliliter, which is the reference we will make throughout the systematic review. So under 12 nanograms per milliliter is vitamin D deficiency. Between 12 and 20 is inadequate for bone and overall health. Equal to or over 20 is adequate for bone and overall health, and equal to or over 50 nanograms per milliliter is linked to adverse health effects. Vitamin D is mainly known for its metabolism of calcium and phosphorus, but it has many other functions, including reduction of inflammation and neuromuscular and immune function. I would like to review fibromyalgia. All of the participants in the studies that I reviewed for the systematic review had an inclusion criteria of meeting the 2010 American College of Rheumatology diagnostic criteria, and I wanted to review what that meant since there's 3 conditions that must be met. The first one is widespread pain index, which means how many areas has a patient had pain over the past week, and the score is between 0 and 19. So the areas that they assess include many to meet the 0 to 19, but include neck, upper back, and lower right arm, for example. And then also they look at symptom severity in addition to widespread pain index, which is the sum of the severity of 3 symptoms, so fatigue, waking unfresh, and cognitive symptoms, plus the severity of somatic symptoms, which also has a long list, but for example includes headache, blurred vision, or nausea. And then the final score for the symptom severity scale is between 0 and 12. So now that we know what widespread pain index and scale score reflect, we know for number 1, they must have a widespread pain index equal to or over 7 and a symptom severity score equal to or over 5, or a WPI score between 3 and 6, and a symptom severity score equal to or over 9. So in addition to number 1, They also have to meet the second and third criteria, which are symptoms have been present at a similar level over the last 3 months, and the patient has no disorder that would otherwise explain the pain. Risk factors for fibromyalgia, I focused on the ones that are pertinent to my population. So women are twice as likely to have fibromyalgia compared to men. And then age. Most people are diagnosed in the middle of life. And then as you age, you're more likely to be diagnosed as well. Assessment tools. There are various assessment tools that can be utilized to look at symptoms of fibromyalgia, signs and symptoms of fibromyalgia. The two that my objective focus on and my PICO question focus on are the Visual Analog Scale and the Fibromyalgia Impact Questionnaire. So the Visual Analog Scale, abbreviated VAS, is used to measure pain intensity. Measurements are based on a 10 centimeter line with 2 endpoints. So 0 means no pain and 10 means pain as bad as it could possibly be. And then the Fibromyalgia Impact Questionnaire, abbreviated FIQ, can be used to measure quality of life. It is composed of 10 items that pertain to physical functioning, work difficulty, pain, fatigue, morning tiredness, stiffness, anxiety, and depression over that past week. Now that we've covered the introduction, I would like to review my research question with you, which is in females aged 18 to 70 who meet diagnostic criteria for fibromyalgia and have 25 OHD serum levels equal to or under 30. How does weekly dietary supplementation of 50,000 international units of vitamin D3 affect quality of life and pain intensity as reflected in FIQ and VAS scores after 12 weeks? I would like to include a review of my selection strategy for research articles to review this question. Inclusion criteria included age between 18 and 70 in a setting of free living community dwelling. Health status, they had to meet the American College of Rheumatology diagnostic criteria. Problem condition, to be admitted to the study, they may or may not be vitamin D deficient. Study design preferences included cross-sectionals and randomized controlled trials. Size of study group, minimum 10 patients in intervention group and 10 patients in control group. Study dropout rate was under 20%. Year range was articles between 2013 and 2023. Authorship included only those most recent research by an author will be reviewed if they have publications with similar content unless the outcome is different. And then I only searched for articles in English. Other inclusion criteria, they had to assess the quality of life and pain, equal to or less than 200 participants in the study, and only use oral vitamin D supplementation. Exclusion criteria included if they were under 18 or over 70 years of age. They were excluded if the study was excluded if it took place in an institutionalized setting. Health status, the participants could not have neurological, rheumatological, endocrine, hepatic, chronic, renal, or cardiovascular diseases. Malabsorption, history of malignancy, active infection, pregnancy and lactation, or did not meet the criteria for fibromyalgia. And they could not be on vitamin D supplementation at the time of enrollment. Study design included meta-analysis, systematic reviews, case reports. Size study of groups excluded if there were fewer than 10 people per comparison group, and study dropout rate over 20%. Anything published before 2013 was excluded. And for authorship, research articles with similar content published by the same author were excluded. Articles not published in English were excluded. And studies not assessing reduction in pain and or functional capacity if there were more than 200 participants in the study, and if vitamin D dosage was more than once a week was excluded. Search strategies for this topic. The databases I used included PubMed, Cochrane Central Register of Controlled Trials, CINAHL, and ProQuest. The search terms that I used that were mesh terms include adults, fibromyalgia, and vitamin D status for population, and then dietary supplements, vitamin D for intervention, and then quality of life, pain, and visual analog scale are examples of what I used for outcome. And then to find the 4 studies that I included for this systematic review, I went through the process of narrowing them down through, I found 15 records total, identified through searching the databases that I stated, and then also found 3 from other sources. After duplicates were removed, I had 11 research studies, and I screened the 11. The full text articles assessed for eligibility, there were 8, and then as stated, I included 4 for the qualitative synthesis, and ultimately decided to use them for my systematic review. So the 4 studies that I looked at, the first one was the effect of vitamin D treatment on quality of life in patients with fibromyalgia by Irsoy S. al., published in 2023. It was a prospective cross-sectional study of 12-week duration. Participants who met the criteria did take 50,000 IU vitamin D3 weekly. And so there were 77.8% of participants that had the 25 OHD levels under 30 nanograms per milliliter. And then at the end, pain intensity and quality of life were measured. And they were also measured at baseline. So they were measured at baseline and then again after 12 weeks of supplementation. And the results showed statistically significant decrease in VAS scores reflective of decreased pain intensity. So you could see this on the chart there that it was statistically significant, so P under 0.01, and then also there was a statistically significant decrease in FIQ scores, which showed improvement in quality of life, so P under 0.05. The second study I looked at was on the effects of vitamin D therapy on quality of life in patients with fibromyalgia. And this was published in 2017 by Dorgu et al. It was a prospective study also of 12-week duration, also had 50,000 international units of vitamin D3 administered weekly, and 60% of the participants qualified for supplementation with their 25 OHD levels under 30, and then pain intensity and quality of life were measured at baseline and again after 12 weeks of supplementation. And this was